You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild. Hello, everyone. Welcome back to the Born Wild podcast. We are your hosts, Sophia,
Leah, Allie,
Nina,
Angela.
We have the whole crowd today. It's very exciting. Let's do check-ins first.
Nina, what's your check-in?
live. That's my check-in. I've been under a rock, under a sick rock with my entire family for the last 10 days.
Holy cow.
But I am well. We are well now. And I feel like a fully formed human in the world again. That's my check-in.
Sometimes that's all you can do.
Yeah, that's all it is.
How are modules going?
Got 8 left.
Woo!
Yeah.
Sorry
And how many births?
3?
3, I think. 3.
I agree.
Yeah. Yeah, I'm getting there. Very exciting.
We'll have to have a dinner when you're done.
Uh-huh.
Crack a bottle of champagne.
Yes, please.
Yeah, and then
Celebrate.
breakfast in the morning.
Sleepover. It's been a long journey.
Almost there.
Mm-hmm.
Angela?
I'm good. I just did in my 20th module, so I have 7 more before I'm halfway there.
That's amazing.
Baby steps.
Yeah. And I'm halfway through my assist births as well now. Got 11 assists. So
I was so surprised to hear that. I was like, in my head, I was thinking it was going to take so much longer, but yay.
yeah, I'm excited.
Yeah.
So
Because you were thinking like maybe September at the rate we've been going?
yeah, looking at our calendar,
Mhm.
seems like September might be
Big months.
a big month.
Sooner if we,
Yeah.
you know,
If you
more.
all of a sudden have a
Get more.
bunch more
Yeah.
July people or something like that. So that's exciting.
I am like a relaxed, limp noodle
That's Allie speaking.
from my bliss day last night.
Yes.
Yeah, I feel good. And I'm almost halfway in this day.
It's interesting how it's been pairing up because for those of you who don't know, Leah and I share an on-call schedule. Nina goes to all the births, and you two could kind of just do whatever you wanted. And you decided to divide it by location of the person. You know, the moms are closer to Allie, you would go to, and it just kind of has worked out so perfectly and even.
Yeah.
Mm-hmm.
Yeah.
I'm good. Yeah.
Yeah.
Yeah. I'm feeling the age thing. It's interesting. I'm not old, but my neck is just
Your neck is old.
It's old. Yeah, no, I've just been having some body stuff. I think this weekend was very relaxing. I think I'm just like exploring what it means moving into this next decade of my life as a midwife and like how to physically care for myself.
Mhm.
Yeah, because I think it's changing.
Mhm.
And yeah, I don't know. Thinking about beef liver capsules, man.
Said the
I've already been
vegetarian.
vegetarian almost my entire life, but yeah, I just
The
feel
iron
like
sounding good.
something.
Yeah.
But yeah, we had a cool birth. Sophia and I both got to be at, which was fun. Done that for a little while. Yes. Yeah, that's it. Neck's a little better. Guess
You could move your head.
I can move my head. Baby steps. Baby steps. So
I feel wrecked physically. I am covered in bruises. I was rushing and tripped on my dog's doggy gate and got tangled in it and fell on it and then fell on the floor, and then he thought that meant I wanted to play, and so he's a boxer and they really do box, and so he was like boxing my face while I was on the ground.
Oh my God.
And Spencer was in the other room. He's like, are you okay? I was like, no. And then he
Good job.
didn't even really help. He was just like, I wish there was a video that recorded how you ended up. It was, cause I think I was like tangled like on the fence still, but like on the ground. Yeah, so I have a lot of bruises. I went to the chiropractor today. Yeah, those are all my updates. We have a couple topics that we could pop around, and I figure we'll just like start at the top and we'll just see what this podcast ends up being about. But the first one was, this is mainly, I mean, I guess this could be for anyone. It could be for midwives who need to talk families through a birth. Maybe, you don't make it to the birth and it just seems like it's either happening fast or they live far away or some sort of situation where you have to. I mean, I find that we usually don't have to necessarily talk someone through the birth so much as like reassurance that the baby's okay afterwards. But yeah, I just wanted to talk about those topics. And this could also be for families who are going to give birth on like what to look for when your baby's born. And yeah, I guess the first thing is just that a reminder. I mean, midwives know this, but a reminder to families that your baby's head can be out and they don't have to be born right away, that there's no reason to like pull the baby out or feel panicked or anything like that. It can be alarming to see just like a head sticking out, but for the most part, usually on the next contraction is all it takes to bring the rest of the baby. And yeah, is there anything you'd add or that you would check in on if you were on the phone with the family and the head was out?
Yeah, I mean, I think what tends to happen, and I have this conversation, I think we both do prenatally, it's usually a second baby or, not a first baby, is that if baby.
Though we just had a first
I
baby.
know, it does. I had that conversation with them too, I think.
Yeah.
But just that, babies that come before midwives get there usually are coming so fast that it's not like the head is crowning for a really long time and then the head is out for a really long time. But yeah, the babies are still breathing through their cord, essentially. So the head can be out. We've had like 10
For
minutes.
a while, yeah.
8 minutes.
I think the longest I had with head out was 6. I think the one you're thinking about is breathing, the cry after.
Yeah.
But it was like a few contractions, and she was like, "Oh, I can feel him like wiggling and shifting, and moving inside." And you can always like as a mom, you could always change positions if you wanted, but that usually, like you're saying, a baby that comes that fast is not usually stuck.
Yeah, and they do fine because a couple reasons, but babies that struggle to kind of get started, get activated, take that first breath, they're usually in the birth canal for a long time, or it's like a really long labor, and maybe the uterine muscle is a little depleted, and the baby's been, pushing for hours and hours. That's when babies are a little stunned. But when they fly out, as I like to say, they're like, hello. Yeah, it's a big deal. But yeah, I mean, I think being on the phone, driving to births, I had a client, second baby, it was like, first one was like 68 hours. That's an H.
Yeah. I wasn't there for her first.
Oh, but you were supposed to be there second, yeah. But yeah, 68-hour labor, first baby, up and down, but like a longer first baby. And then the second one, they lived like 10 minutes from me, and I got there 5 minutes after. It was like, I'm having regular contractions. I was like on my way. I got a text that said the head is out or crowning or something. I was like, what?
And it's not even like you live far away.
No, it was also just a funny text.
Yeah.
I called. I was like, so, and then I was there like 4 minutes later. But yeah, just stay on the phone, breathe, do your thing. I mean, the truth, and this is like the core of our philosophy, is that you actually don't need us there. So if it happens without us there.
Well, and I think my reason, because I feel a little anxious not being there, and I recognize that the reason I feel anxious is because I'm worried that they'll be worried and that I wasn't there to give them the reassurance, and that if I was there, I could have been like, no reason to rush, be patient, the
Yeah.
baby looks fine. And like, but that's the role I want to play if there is a role to play. And that sometimes there's only so much you can do on the phone because you can't really see, And so I've, had to talk a couple people through a baby who like didn't come out screaming and crying and was fine, but like on the phone, how do you communicate with families and reassure them and reassure yourself that the baby is actually fine if you can't hear anything?
Yeah.
So I've found, because we know APGARs and there's so many things you could check in about, but like color doesn't really mean too much in that situation, cry. We know that they can be totally fine and wait a long time to cry. So usually what I've been, when families are like not sure how the baby is, I've been checking in about tone, I think, because I feel like that could just tell you more. Like, is this and a floppy baby can still be fine too, but it gives you a little bit. Like, if you're gonna ask any question, it's like, how's the baby's tone? Like, does the baby hold your finger? Like, when you pull the baby's leg, do they pull back? Like, are they active? Because then if they are not, you can say like, feel free to like rub your baby, like try to encourage movement from your baby, to like, or like, are they opening their eyes? Are they blinking? Like, do they look present with you?
Yeah.
Doesn't matter if they haven't taken their breath, and if somebody's concerned about heartbeat, grab the cord, feel the cord. Is there a pulse in it? That's the easiest way to check for heartbeat. But yeah, because I have had some babies who've taken a while. I mean, the longest we've had at this point was 12 minutes to do their first cry. And we were at that birth, so we could like see the baby. But I've found that the tone question is your best reassurance that this baby's present. Yeah, they're here. Yeah, because there's always the question where you're like, do they need to call someone? You don't want to like reassure someone artificially and then something is up, and you told them it was fine.
Have you ever thought about like pulling over and having them FaceTime you so you could look and see what's going on? Like, would it be more valuable to have a visual and not be driving, or to get there faster? And I guess it just depends on the situation.
Yeah.
If someone like really couldn't communicate how the baby was doing, I think pull over and FaceTime.
Yeah.
I haven't done that before, but that seems like could be a good idea.
I did it once and it was so choppy it didn't feel helpful at all. But not to say that it would always be that way.
The last couple of times that's happened, you've gotten there pretty quick after the phone call, right?
Yeah, I mean, except for the surprise breach we had. First time mom, 4-hour labor, surprise breach. I was still like an hour and a half away because when she hired us, she lived 2 hours away and we're like, it's your first baby, it'll be fine. And then it wasn't, I mean, it was still fine and it was great. But that was my first time like talking someone through the reassurance of a breech delivery too. I had never done that on the phone before. And so, like when the legs come out, we look for like the tummy crunch, with the breech baby. But I didn't like say to him, hey, so when your baby's legs come out, this is what you're going to be looking for. And so after he was like, okay, the legs are out, I wasn't going to be like, did your baby do a tummy crunch? So I was just like, well, do you see the baby moving? Or does the baby look floppy? And like, as I'm saying that, I'm like, but the baby looks floppy after the tummy crunch, know? So if you miss that movement, he might say the baby looks floppy, and he said the baby looks floppy, and I was like, okay, well, it could be totally fine or it could not be totally fine. And so I just erred on the side of safety, and I said, well, let's try to help the baby out, and so I walked him through, just reach up behind the baby's back and find the arm, and the arms came so easily. And then how I directed him with is it just called shoulder press, or is there a name for it? Is there somebody's last name for it?
Some old term.
So she was on hands and knees. So after the arms are out, I said, okay, you can put your palms on the baby's shoulders and chest and just push horizontal, like along like the floor, towards her face. And he did, and the baby came. And I remember after they were asking me one postpartum visit, like if that was really necessary, if the baby was stuck and needed help out. And I said, the baby came so easily, probably not. And I explained the whole floppy tummy crunch situation where I was like, I didn't know. I wasn't there to like witness.
And that's a super unique
Yeah.
situation.
Yes.
So, but yeah.
But these babies can move
It does
in
happen.
labor and flip.
Yeah.
Yeah. So, but yeah, it was interesting to be like, oh, I know what I look for if I'm in that situation, but to communicate it to
Mhm.
somebody who is probably like really nervous,
Yeah.
and it was, yeah.
Do we have a document or a handout that we give, like if labor happens really quickly? I feel like I've seen that in our documentation.
I don't know if I have ever had one. I've just kind of said,
I had one in the past
Yeah.
in
Mhm.
handbooks, but I don't think we have one.
Yeah, good.
Yeah,
should go over with
made herself a project.
I'm not saying that. Because we talk about so many things at birth team meetings and stuff. And
Yeah,
it's
and
just
if you
like,
can even remember
it's
it.
just
I feel like I always talk about it.
yeah,
But it would be good to actually have a
have
document.
it on the fridge.
Put it on the fridge. Yeah.
Remember that document that we had? This is what we look for in case we're not there.
Yeah.
Yeah. Another thing that has been coming up in our practice is this transient tachypnea.
Yeah.
Well, as Allie calls it, hyperventilating.
Temporary newborn hyperventilating.
Yeah, that's
Temporary
Latin.
hyperventilating.
Just get them a brown paper bag and they're fine.
Mhm. Yeah. Does anybody want to like touch on that? Because we've been seeing it. I feel like at least 3 or 4 times, like in the last couple months.
Yeah, I had a client a couple months ago. Really straightforward birth, no issues, and baby's respirations right after the birth were normal range. Some babies hover between 60 and 70 a couple hours after birth, which is pretty normal. They're just still figuring it out. Baby's lungs were clear, no other stuff going on, normal temperature, feeding like a champ. And then later in the day, baby was born at like 9 in the morning, 10 in the morning, something like that. They sent me a video of breathing, and he was just breathing fast.
Yeah.
He didn't have any retractions or grunting. He didn't look like he was struggling to breathe, but his respirations were like 100.
Yeah.
So I went back over and just double checked that was what was happening, and everything else was totally, absolutely normal. So we talked about TTN, transient tachypnea of the newborn. And we decided they wanted to wait and see what happened over 24 hours because everything else was going so perfect. And then the next day I checked in and they were still the same, I think.
Mhm.
And we did a O2 on the baby. We used the pulse ox, and it was like on the lower end of normal. And
Like 95, 94.
95-ish. And I think just because like if it had been one or the other, we probably would have I was like, you could wait it out and see. Not seeing any signs, because the issue with there could be underlying issues with oxygenation, the heart, all that stuff, but mostly it's just exhausting. Like you try breathing really fast for 24 hours. It's dehydrating, uses a lot of energy. And he wasn't showing any signs of that, but the combination of the two, they did decide to go in to the hospital for just to like make sure, and they
More
found
peace of
that he
mind.
had a murmur that they were just going to keep an eye on. But they just observed him.
And his oxygen did actually get lower.
It did. It went
high
into the 80s.
Yeah.
At one point, and then stabilized. And the pediatrician there said that he had seen babies with that for 2 weeks before, but they never gave him oxygen. They didn't do any blood work. They didn't give him anything.
I was surprised how hands off.
Yeah, it
the
was
experience
really,
was.
really hands off.
Ever in general.
Yeah, they really just observed him. And then I think they were there like a little longer than they wanted to be because they wanted to see his oxygen levels at like a certain place for a certain amount of time. But yeah, then they went home. So it was like one of those situations where you're like, oh, that's a bummer. We went in. Seems like we didn't need to, but like the peace of mind. And some families are just really like, do not want to go in unless it's absolutely clear it's an emergency. And some just wouldn't get a good night's sleep.
Yeah.
Not being sure.
And it's so great having that story and having that story actually of them going in and the hospital being so hands off because after that we had a baby with TTN and we were able to share that story and like not that this would be your baby's story, but like sometimes even the
happens.
hospitals
Yeah.
are just like waiting and watching,
Yeah.
you know? And so I think since then we've had a couple families with this situation and they opted to just stay and like we, taught them how to count rest
Yeah.
and they could check temperature and they could do all these things just to make sure everything's normal if they wanted that reassurance. And it all resolves.
Yeah, the last birth that I was at where that happened, the baby's oxygen was still totally within
Mhm.
range, so
Yeah.
that was interesting.
Yeah.
It was really fascinating.
Yeah. Even up to I think we've had like 120
Yeah, that's what I'm
respirations.
thinking.
Yeah.
That's wild.
Yeah. Yeah. And then just
I kept
resolves.
on, I listened for like 3 or 4 minutes because
Yeah.
I was like, am I actually?
I think
Sophia had to double check me. She's like, there's
Yeah.
no way.
I was like, student, she's listening to the higher speed.
a double beat every time. But it was, yeah.
And I can say let's a little student because I love Allie. But yeah, I think it's important to share these stories because then if you have it in your practice, you don't have a potential like freak out of
Yeah.
like, oh my gosh, this baby, that you can hear stories where it did work out, and we've had at least 4, like I said, in the last, at least this year, if not the last couple months.
Or clients who are afraid to go to the hospital thinking that they're gonna do a bunch, that
Mhm.
they might just
There
observe.
could be a
so-
baby that there is something going
Yeah.
on,
Yeah.
you know, and just because we have stories that are like, oh, and it was fine, doesn't
Yeah.
mean that you shouldn't look
Yeah.
for those things and
Have those
give informed
Yeah.
consent
Yeah.
and talk
Yeah.
about options because there can be a baby
Mhm.
where everything seems fine and they have
Yeah.
really high rest when there is something
Yeah.
going on.
Yeah.
you
And
know?
our rule is like we give all the information and let the parents have their risk analysis because some people would err on the side of safety and go in and others wouldn't. And we let families know if you want us to make the deciding factor, that's totally fine. We're always going to err. We're always going to go in. We're always going to do the test. Like we're not going to be like, let's just risk it and stay
Yeah.
home. But another good thing to note is a baby that is struggling with breathing will not nurse. They won't feed because they're prioritizing breathing. That was a thing that went on with my son was he would not nurse, but he was struggling with breath, even though his breaths were in normal range. So that's important too. If you have a baby that's like nursing awesome, it's less of a concern.
Yeah, something to take into account.
Yeah. We did have somebody write in with some questions. And I'm attempting very quickly to pull them up on my phone. Just trying to remember what account it was under.
This is circling back, but I'm wondering with you guys as doulas, did you guys ever catch babies because the midwife didn't get there in time? No? There's so many doulas that happens to.
I don't think I
Happens
would
to me,
have
like
in parking
3
lots.
times.
Yeah. I don't think I
as a
would have
doula.
caught. I just would have.
I mean, I've been.
parent
well, you know what I mean. Be there.
Yeah.
Been at a birth
Almost.
as a doula by yourself because the midwife hadn't got there.
Yeah.
I've
Well,
had it
Allie's
almost
done
happen.
planned assistant.
Yes.
Yes.
And I've had, I mean, close, like within minutes.
Yeah.
midwife comes.
Yeah.
Yes.
Yes, that's.
Okay, here's some questions. Michelle Seaver, I hope I pronounced that right, had some questions. She's a future nurse. She wanted to know what are some holistic methods we utilize when helping women birth babies, just in a very general question, and what successes we've seen with these methods. Do you believe holistic medicine has a place in hospitals? If so, what is the future of holistic medicine in hospitals during labor and delivery? I'm guessing holistic medicine. I mean, the first thing I think of is anything that's not like a drug.
Yeah, acupuncture, herbs,
Chiropractic.
chiropractic,
Mhm.
any like
Yeah.
alternative methods.
I mean, my most dramatic story, I think I've shared it a couple times, but when my daughter was born by cesarean, her lungs had collapsed and they had told us there's nothing they could do for her. She'd just be on oxygen the rest of her life, and we did sneak our chiropractor in, and she was fine hours later and hasn't had any issues. So I do believe that chiropractic belongs in hospitals, and I think of all the babies that could have been helped by that kind of support.
Yeah.
I
I think that there's a lot of ways that it already has been, and I mean, especially with like positional supports and
Getting doulas in
the
the hospital.
understanding about physiology and then physicians and all of that having doulas.
Yeah, spinning babies.
Yeah.
Yeah, that knowledge.
More wireless telemetry units and things like that. So there's more free movement and people can get in the shower or bath.
Tubs.
Yeah,
Water.
more tubs in the hospital would be great.
I mean, in Marin General, they have essential oils available for people, they like readily
awesome.
offer and them. So that's like a way, just for relaxation or for boost of energy with peppermint, things like that. So that's a big.
Are there any
That's
like
right.
tinctures or homeopathy that you guys pull on? I'm just kind of teaching myself because in my apprenticeship, that was not a piece of it. Though she just didn't know a lot about that. So I'm just kind of learning. So it's not my go-to just because I didn't like grow up that way.
I really like tinctures. I feel like I don't use them a ton, but I feel like they've been extremely helpful. I mean,
Can you name any and what you
Yeah.
use it for?
yeah, so like passion flower and skullcap I've been really into lately, and I feel like for blood pressure, it's like huge game changer, passion flower. Prenatally, when moms have had kind of creeping blood pressure and we've addressed other potential like bigger picture issues, doing that has had people stabilize their blood pressure in labor for sure, like dramatic drop. I also just think sometimes in labor when you're feeling overwhelmed and you're like maybe in that transition between early and active labor, kind of letting go of like the fear of like, oh, this is bad now and I'm only this many hours in, how is it going to be? I find that like, and skull cap too for that, for headaches. I've had a couple clients do skull cap and that's been really helpful.
Motherwort is really nice for that too. Like feeling safe and releasing fear.
Yeah. And then in labor, I think we use, the smooth transitions tincture I found to be really amazing.
Wish Garden.
Wish Garden. Yeah. And then cotton root, cohosh. Yeah, I feel like I use tinctures. If people are asking me for something that they can do, it's interesting to talk about like what holistic things do you do to help birth? It's sort of like, well, birth in itself is a holistic event. That's the whole body and is a natural function. So
you could just do
if you're really
you're
just not doing anything. It's like to be holistic in the hospital and have like wireless monitors or whatever. It's like correcting what you're doing to take it away from being holistic by sprinkling holistic things in. Right. So it's just counter thing. But
another question. Do you believe in complementary care like Western medicine and hospitals combined with holistic medicine and like the benefits of that? I think that would be like a dream world where we could like start one way but be graciously accepted.
Absolutely. It would be amazing to have like a body balancing specialist, spinning babies person, and a chiropractor on call at the hospital, and people who could come in and work on things that are come from an angle that's just not available in those settings.
And offering the postpartum support that midwives offer, like for people who birth in a hospital, you don't have to go.
Or if you can't hire, the hospital should be hiring a midwife to come do
it.
Midwives.
Well, in Europe, they have people, nurses or midwives that
yeah.
are just paid for by the health service that come to your house, and not as frequent as we do, but a decent amount. Yeah, it's interesting in the hospital, like with the chiropractor, acupuncture, people who have like graduate level degrees in other modalities of healing. It's not like they're Reiki people coming in. Like these are people that have doctorates, so and I think that so many people who work in the hospital system and who go there, people who would consider themselves like very mainstream Western medicine people, it's covered a lot now, like chiropractic care, things like that. Like it's becoming more and more mainstream. So in the birth context, like for labors or for immediate postpartum, having an acupuncturist there, like I just wonder what bridge needs to be crossed, or a chiropractor for babies. Like, is it liability? They have liability insurance. Most chiropractors do, I think.
And because like Kaiser has chiropractors, but they're just not like a part of the birth world.
Right. So what needs to happen to bridge that? Because absolutely.
And nothing against Reiki providers.
No, I'm saying like you can do like a 9-month on the weekends or like
Right,
online only Reiki course, and they're powerful and beautiful, but it's different.
I know
than,
what you meant.
4 years. I think Jen would be a little pissed compared to no, but you know what I mean. Yeah, it's an interesting idea. I think it brings up conflict in me too. Like I just said, I'm feeling political right now, but it's like, like that is absolutely great. And for someone who like needs or feels safe in the hospital, having those providers as part of it is amazing and good. And it's also like they're fixing the problem.
And like we had talked to a
They're
NICU,
creating.
we had talked to a NICU nurse who, if my memory is right, also does craniosacral work, right?
Yeah.
And so she was saying
Yeah.
that like sometimes like it's like if you can like learn these modalities yourself too, be able to
I mean,
offer them.
nurses are starting to. I mean, there's a lot of nurses who know spinning babies things and are recognizing posterior babies when before they would just be like, it's just back labor. Like,
and even in the last like year or two, like the lactation consultant, like at Marin General and Marin Health, they have 24/7 lactation consultants available that are amazing. A lot of them are, several of them are retired midwives, like home birth midwives. But and they have like massage available and stuff.
I know I had somebody come do massage when I was in the NICU, and I was like, but we had to sneak the chiropractor in, you know.
And pelvic floor therapy too. I feel like is something that should just be built into coverage of postpartum care, and like it's just kind of an afterthought.
In other countries, it is part of it.
Yeah, in Germany they have these classes that are called after birth gymnastics. That's like the translation, which doesn't make a lot of sense, but it's like pelvic floor stuff. And you just go and people come to the birth center, swipe their insurance card, and there's just like, when are you doing this class? Like it was just completely normal. You did like 4 of them, I think, in the first like 3 months or something.
Which is like true for any other major event that happens with our bodies. We break our arms, so we like go to physical therapy. Like, not that birth is a pathology, but it's a huge event for our bodies. As we know.
And the lifelong ramifications of having a weak pelvic floor affect you for your whole life. Can't tell you how many like moms in my kids' preschool class were like having prolapse surgery, and I was like, when did you go back to work? And they're like, 3 weeks postpartum. I'm like,
which we will touch on that realistic postpartum expectations. Another question was monitoring babies during labor, and does it just have to be machinery, or are there other holistic ways to monitor mom and baby? And the only thing I could think about is mom's connection to the baby. Like she can actually feel a baby move, her intuition. I've had, as a doula, I had a mom reach out to me at 41 weeks and was like, I was showering and I just feel like something's wrong. And she went in and like there was something wrong with heartbeat, and she got in for a C-section. It ended up being, baby's fine after like some brain cooling, but it was like there was no machine that told her that. She was just like, something's not right, and she was like, part of me was like, oh, you're nervous, you're being dramatic, but she just went in and double checked and potentially saved her baby's life. And
I mean, kick counts are something that people can do quite before, and I guess during labor. I've never had that done during labor. We're like, sit down, be quiet, and kick count. But definitely
checking in with movement for baby.
And a lot of times they're saying like, oh, the baby's moving, and every time they move, it causes a contraction.
And I always chart like when that happens, just so we have it in records, like if they do say, because sometimes there's so many sensations, they're like not even really paying attention to that. Let me see some of the other questions. We kind of touched on how to manage pregnancy symptoms holistically. Is an episiotomy considered a holistic intervention? Absolutely not.
It's not even evidence-based.
Absolutely not. If someone uses your services, do they still need an OB at a hospital as well? No. You would need them if you needed surgery.
You just get whoever's on call.
Are there any differences in successful pregnancy rates between utilizing holistic services and midwives as opposed to doctors' offices? Wait, I'm not even sure what that means.
Are the outcomes better?
This is totally unrelated, but I thought I just had. I remember Dr. Stu at the breech workshop was talking about OBs because he's an obstetrician, and just the idea of like what can an obstetrician do that someone else can't?
Surgery.
Surgeons can do surgery. I mean, if you're a trained
Sure.
surgeon, you could do a C-section.
Yeah.
You can take out a gallbladder or do it like they're all trained in that.
Right.
So like,
I mean, they're specialized in cesarean.
well, they do them a lot,
Yeah.
but if you went to an ER,
Are they doing any other surgery?
Third degree, fourth degree.
I mean, OB/GYNs would do like hysterectomies or, I mean, they just do any uterine surgery. They have more practice at it, but like if you were in a rural area and you were pregnant and you rolled into an emergency room and you needed a cesarean, any surgeon there would do
That's
it.
true.
Right.
They don't have to have obstetrician.
Yeah.
But the point is they could do it.
Mhm.
You know, it's just
It
like
was a life or
like,
death situation.
you know, a nurse, a midwife, I don't know, techs can do this, like they can place an IV. You know, like what specifically do you do that nobody else can? Because they don't resuscitate babies, right? They don't put in IVs. They don't. I mean,
They don't do that epidurals.
They don't do the epidurals. You know, they pull babies out, not always. Some they're good OBs, but like what is it that they do that someone else can't do? Nothing. It's an interesting thought, right?
Yeah.
I mean, I think he was saying that in the context of when people are no longer doing breech or twins, like for a twin extraction. Like if you're not willing to do that anymore, all you do is a cesarean.
You don't separate yourself from
what do you
anyone
have?
else.
That
Just
that-
another surgeon.
Yeah, exactly.
Do CNMs in the hospital do like vacuum extractions, or is it usually
Yeah.
OB?
They can. And hospitals are going to.
Yeah, so I guess there's that. They can vacuum your baby out.
But apparently so can a nurse midwife.
Who'd have thought? It's just interesting because there's so much importance I find like when I'm talking with people, understandably, because we just don't know what you don't know, but it's like, but don't I need this backup person if I'm gonna do midwifery care or any other kind of care? Like, but I need to have this person in place who, it's just interesting.
We're at the end of our time, but last thing I just wanted to note is I want to make sure everyone who is a provider or a parent knows about the fresh test option for gestational diabetes. Do one of you want to just briefly mention it? And we'll leave a link in show notes.
It's just the glucola alternative. I don't know much about it, just that it's not glucola.
Yeah, I think they have different levels of glucose. And I know it just doesn't have any artificial colors or flavors or anything like that. And it's a powder.
It's labeled organic.
Yeah, it's organic, so it's shelf stable.
And it's an easy way to get the 50 grams.
Yeah.
Yeah,
so
and
you
it's
know
like
exactly
I think
how
it's
it
like
is.
$6 too, so it's not expensive. Providers could even carry it if you wanted because it's shelf stable. And also women when they drink it have reported like, oh, that was delicious, I would have another, not like these other reports
It's
of
like having a glass of lemonade
Yeah.
as opposed to
Right.
where they're feeling like they're gonna vomit and they have to have somebody drive them home from their appointment.
And labs are cool with using it, which is the best part.
Yes. Yes. Yeah. So that's a great option. We'll leave that in show notes. And thanks for listening today.
Bye.
Okay, everyone, that's it for today. Thank you for listening to the Born Wild podcast. If you enjoy our podcast, please rate, review, and subscribe every week to get the latest one.
And please follow us on Instagram at Born Wild Podcast, as well as Facebook. You can also write to us at info@bornwildmidwifery.com, as well as our website, bornwildmidwifery.com.
And remember,
Stay wild.